When I was running for election a year ago, one of the top issues that I heard people, voters, concerned about was the health care issue. And over the past year, I've hosted hundreds of meetings in my office to talk to people about the health care crisis. And while I appreciate the doom and gloom scenario about how bad the state budget is and how this is going to detrimentally affect the state budget, I want to remind you that this is a self-funding mechanism. And I want to talk a little bit about the workers that are providing food for your table that live in my district, and the workers that provide an opportunity for you to visit some of the most beautiful locations in the state of California. Those workers provide all of us with an opportunity to be here today because we live in one of the wealthiest states in the country, and yet they have no health insurance. A study that UCLA did in 2001 indicates that in the 28th Assembly District, the 4 counties that I represent, Monterey, San Benito, Santa Clara, and Santa Cruz, parts of those counties, that the uninsured costs that were borne by that county, by those 4 counties, was $754 million, indigent costs to the county. Now that costs all of us, whether it's through our health care system, whether it's through the insurance premiums that we all pay. One way or another, we're paying those costs. And those indigents that are receiving that care are receiving it at the highest cost, at the worst opportunity, when it's an emergency. And they have no other option but to go to the county hospitals or to go to a clinic and ask for help and resources. This bill is not a perfect bill. Quite frankly, most of us believe that a single payer system is the way to go. And as you all know, we're not going to get there. So we have a choice. We can either start taking incremental steps and improve the health outcomes, the health care for our children in this state, and for those working families that are working so hard to make sure that our state stays healthy and strong and our economy is vibrant. This bill will provide insurance coverage. It will finally cover 36 million Californians. It'll finally cover 5 million that are currently uninsured. All children will be covered, working poor adults, indigent, the ones that cost us so much. Farm workers in my district, service workers in my districts will be covered. And most importantly, this bill starts to implement a strategy to focus on prevention. Prevention which will make a huge difference in obesity rates, diabetes, tobacco cessation. Those are the illnesses that are driving our health care costs up. So we can show up here over the next few months and do nothing, or we can decide that now's the time to act, that now is the time for us to make a difference, helping to keep our health care costs lower and starting to provide coverage for people who desperately need it, who are overburdening our system. It's for that reason, looking at the faces of the people in my district who have come to my office and asked for leadership on this issue, I ask for your aye vote.